first of all, I want to point out, as I said before, when you just said the dysfunction, it's moved past dysfunction to malfunction. And I think that's a really important thing for us to get, because if it's only dysfunctional, there's still the suggestion it can be fixed. Malfunctional means no, we have to scrap what is. This business of incremental change. So what we need is for these agencies to be cleaned out. What that means is the corporate forces that have so much control. So this is how it works. You have some big CEO of some big food company or chemical company or agricultural company, somebody really big who says whose company is paid, millions of dollars, and they have to do with the election of presidents and so forth. And they make it clear they'd really like, this is the list of people that they would like to head that agency.
To take note, everybody, of what was just said.
That's right.
I hear you.
Right. And that's who they choose from because it's their club, right?
Yeah.
So you need a president who says, I'm not going to appoint one of those people to this agency. And everybody who has a past, and there's this revolving door in Washington that you work in Washington, then you go work in the corporation, then you come back and you work in government. And so if you've worked in government and then you go work in the corporation, you can tell the corporation, well, this is how it works to get what you want. And then if you worked in the corporation and you then come work in the agencies, then you say, well, this is what the companies really want. Even in our Secretary of Defense used to be a board member at Raytheon.
Wow.
So you have people from big ag and the agricultural department. We should be talking about regenerative agriculture. We should be talking about carbon resequestration. So many of the things that really have to do with solutions at this time don't provide short-term corporate profit. So you've got the solutions over here and the power over there. And this applies to food and nutrition as much as anything else. So you need a president who knows that she's appointing people. Those people are not welcome during my term, right? That we will not have we will have the people who know about the repair work and know about the solutions. And you know as well as I do, Mindy, not only in this area, but in every area, we have the people who understand, who stand for alternative ways of being. We don't lack that in this country. It's just that they are not invited to the seat of the table of power. And then you have a president who proposes such things that you were mentioning, my whole health plan. My whole health plan does not just have to do with how we treat sickness, which needs to be a universal healthcare system like every other advanced democracy has. We have now 1 in 4 Americans living with medical debt. We have 18 million Americans who cannot afford to pay for the prescriptions their doctors give them. You were talking about that lowering life expectancy. We have 85 million Americans who are underinsured or uninsured. Now, what that means is you have a lot of people in this country whose insurance will pay for them to go to the doctor, but it will not pay for them to take the test that the doctor prescribes, or to have the operation that the doctor prescribes, or take the medicine that the doctor prescribes. A doctor in Detroit told me, there were 2 doctors who said things to me that have really stayed with me. One was a woman who said, when I used to diagnose a patient and say the treatment that I was prescribing, the most common question I used to get was, what are the side effects? Today, the most common question is, how much would it cost? Yeah. This kind of thing is so prevalent that a cardiologist in Texas said to me, I don't even know why I'm bothering to practice medicine anymore. People come into my office, I know it's wrong, I know what to do, but the insurance won't cover it, right? Yeah, so you need universal repair. Also, in my plan, let's say you go to the doctor. I love this one. Let's say you go to the doctor. Now, that doctor has gone to a Western, might be a very fine doctor, but really trained in mainly pharmaceutical treatment. So according to my plan, you go to the doctor tells you, this is the medicine that I prescribe, pharmaceutical. Well, it is mandated by law that the doctor also has to open their computer. And for that particular sickness or condition, if there is a provenly effective non-pharmaceutical remedy, you have to be told about it. And then you get to decide. And then there are also such things as gym memberships. The idea, there is so much that we could do. Even parks, there is so much that we could do to make sure that we are proactively cultivating health. And where I'm very concerned, as I'm sure you are, has to do with early childhood. Oh, yeah.
Well, that's where a healthy body is made.
That's right. Well, even on the brain, we have 90% of a child's brain is developed in the first 5 years. That's why I want a Department of Children and Youth. We have to transfer resources and focus to the lives of children under 10. If you want a thriving society 10 years from now, we're going to have to pay more attention to children under the age of 10. We have hungry children in the United States. I mean, hunger right there, which is so outrageous. But we have the highest level of poverty and child poverty in this country. What does poverty mean? Hunger. We have over 30% of Americans who now report regularly skipping meals. Well, what does hunger
Wow.
do to a developing child's brain?
Oh, yeah. Wow. Yeah.
And maternal health, women, even while they're pregnant. We have food deserts in this country where they don't even have fresh fruits and vegetables. A lot of the obesity issue in children is not that they're not getting enough to
Mhm.
eat. It's that they keep trying to eat more calories. But where are they going? They're going places where maybe they can get corn nuts.
Yeah. Yeah.
Or
Yeah.
candy, because the body's just trying to get, and they're not. So all of these things, of course, produce sickness. And then, of course, society pays for it on the other end.
Do you see that when we look at a preventative plan, like the doctor having to tell you of a lifestyle tool, the big picture challenge that I see with that is you're going to take these major corporations, financially out. And, is there a way to see preventative care as a profitable way to approach healthcare? Since we know profits are what so many corporations are looking for, is there a way to even make prevention profitable?
Well, I think, you could look at the, health food business. I mean, obviously, there are those that do.
Somebody.
When you have 1 in 4 people living with medical debt in this society, you have an $88 billion medical debt. Meanwhile, if you take the top 5 pharmaceutical companies, last year alone, their profit was $80 billion. So there's such a thing as righteous profit. You and I sell books, and there's a win-win. That's one of the reasons I love the book selling. You put in energy and get something back. Your publisher put in energy, gets something back. The consumer who buys the book puts in energy and gets something back. It's a win-win. That's healthy capitalism. That's righteous profit. But when you have one party taking so much of the profit, I mean, right now you say with their profit, we're paying for it with our lives.
That's right. That's right.
So,
yeah.
So you know what I'm saying? There's profit, and then there's profit that's actually not even profit, it's theft.
Yeah.
And when you were taking the life force out of people in order to make your profit, here's your profit, here's my life.
Right. Right.
So I think we
have
to have that discussion about healthy capitalism.
So one thing that I've heard from a lot of doctors is that they say when I give a lifestyle choice to a patient, they don't want it.
Sometimes we all know that. I mean, sometimes it's easier to pop a pill. I think we all have a little bit of that in us, It's like, your book, right? Yeah, I called you to tell me how to do the, well, it's hard, So I think we're all facing that, that we were brought up in a culture that was all about, well, give it to me quick and give it to me easy. And pill popping was part of that. And now people are recognizing, but also there's something else involved there. The lifestyle changes would be much easier if the entire society was healthier.
Ooh, yeah.
You know what I mean?
Yeah. Sorry. One of the things that I see in food, there was it wasn't really beautiful, but there was an interesting article that came out a couple years ago saying that the F is silent in the FDA, that we don't have a good regulation around the chemicals that are going in our food. And so again, I'm going to come back to, and I want everybody listening to think this through, because when you hear what Marianne's saying, to me, it's like, this is so logical. Why would we not have a government that's going to bat for us to make sure that we're healthy? But then we also have to ask ourselves, our favorite foods that we love and we eat over and over and over again that are sprayed with chemicals, are we willing to give that up? Are we willing to make a change to be healthy? And I think, and I'm just offering this up to you, Marianne, that I feel like if we could get the regulations around ingredients in food, and we could make it so that food isn't addictive, it's not creating dopamine responses in everybody's brain. Now we have a door in to getting people to being willing to be more responsible for their lifestyle and the food changes that they make. What are your thoughts on that?
Well, of course, when you said that the F in the FDA has been taken out, it's like I was saying to you before, the FDA agent used to be able to say, get this off the shelves. And today they have so dejuiced the FDA. They've taken the power away from the government. And if you try to suggest that it be put back, their PR is, oh, you're a socialist. They call that big government. Government has a role. You can drive a car, but there are traffic laws. It's understood that the government has a role in making the roads safe. safe. It's understood that there's a federal aviation, it's understood that the government has a role in making sure airplanes are safe. And there's nothing to be apologized for that we think the government has a role in making sure that food is safe. The opponents to all this, they have their PR, which is that's overreaching government. And of course, our response to that is no, it's overreaching corporate power that's happening right now. We all know, and you would certainly know, that our taste buds get addicted, as you were saying, our brains get addicted. And it takes some time, doesn't it? It takes time to sort of clear all that out and get to the point where the cherry really tastes good, the grape really tastes good. On the other hand, another factor there is how often, because of everything we're talking about, the cherry doesn't taste that good anymore. The grape doesn't taste that good anymore. There's so much dead food in the United States,
So much.
It's all of the above. And I think that the most essential factor here is awareness. I got stuck a few minutes ago when you were talking about the young woman eating potato chips. I mean, I would have thought that any woman reading your books at this point would know that's poison. I mean, that's why books such as yours are so important. And I also think if you really, there are so many things about our lives these days that if you you can't chew the whole thing at once. There's a lot of
it's too big.
There's just lean in.
Yeah.
I have a thing for green grapes. There's something about the natural sugar in green grapes. It helps me not have a craving for bad sugar, right? But it does take time, I think, and awareness to cultivate better habits and to release bad ones. And if we start shaming ourselves or making ourselves wrong, then obviously the change happens more slowly rather than more quickly. But one thing we must start doing is holding our government accountable. And our politicians quite simply lie to us. And some of them don't even know what's going on over the FDA.
Yeah, that part is crazy.